up. So a good idea is actually to get your foot over the front and take a bit of the body weight up, and then he can lift himself up. He's done that naturally. He's put two hands on the ground, one elbow, one hand. Now what you want to do, it's basically just a massage for yourself. So what you do, you line it, you're pushing your body weight into the side of the foam roller, and what he's going to do is slowly roll down, good, take his leg down, and then back up the side like that. And what it's doing, it's stimulating blood flow, it's kind of plastically kind of opening up the muscle, and trying to change a bit of the chemistry along the nerve pathway, because there's a big sciatic nerve or a peroneal nerve that runs through there as well. So Pap's doing that really well, and what he can do, he can go right down. Now, things to avoid are just like sharp shooting pain, pins and needles tingling, your feet going numb. Obviously, you don't want to do that, right? Now, come down there, Pat, we'll straighten up so don't roll off the table. Yeah. Cool. Okay, so now he's pretty strong. He's a nice, fit, strong dude. What he can do, he can come up this way. Now, if he wants to increase it, he can take all the weight off. He can lay his legs on top of each other, and that brings on the weight, and he's going to get a nice, big, deep push right into there, doing exactly the same. Now, what you want to do, when you're doing this, you probably want to spend a few minutes at least, probably, you know, 3 to 5 minutes of rolling on and off. You wouldn't want to go 5 minutes straight. You'd go about 45 seconds to a minute constantly. You'd have a break for 10, 15 seconds and back into it for another couple of minutes, okay? You don't, I mean, if you're nice and strong, it'd be a big workout for your core. It's like doing a side bridge for 5 minutes otherwise. He could probably do it, he'll eat it up. But if you're beginning at it, you don't want to push yourself too hard. All right, have a little rest there. And then the next one, if you want to put an extra weight on it, you can actually lift up. He can use his own foot to push in a little bit. You got that? Nice and firm. Now he does this stuff naturally because he's so used to it, but it does take a little bit of practice. I mean, he looks perfect on there, right? But it does take a little bit of practice. Now, the second bit of this, when you're using the foam roller on the outside of your shin, they're the muscles down the front. There's a group of muscles, we'll call them tibialis anterior, but they sort of hold the top of your foot up and they extend your toes back. What Pap can do here, he can roll a little bit further forwards. So he can roll onto, you can put your leg down by the side of him, yeah, that'll do. And he's rolling almost, he's on the foam roller here, but he's on the front of his shin. Beautiful, and he's going nice and slow. Again, up and down, perfect. It feels okay? Mm-hmm. Sweet, mate, he's doing a good job. Then, the last bit of add-on that we can do, you can actually start dorsiflexing, plantar flexing, or just bending your foot up and down. A really lovely way to get a nice a nerve and a myo muscle and a fascial release, neuromyofascial release, is to move your foot around or move the body segment that you're trying to stretch as you go through it. Cool? You feel okay? Perfect. He's going to have a lovely loose leg after this. Yep. Cool, man. Thanks, mate. Okay, so the next thing that we're going to do, now that we've rolled that out, let's teach Pap how to do a bit of a self-release. Now you can do this, this is lovely. This is lovely for runners especially. Anyone getting sort of those anterior or those front shin splints down the front of their leg. Now, I'll put a bit of cream on his leg, but you don't really need cream to sort of do this. You can do this at home, and you can do this when you're watching TV or sitting down or anything like that. You put a little bit of a bend under your leg. Now, something I've figured out, genius, is your heel basically fits perfectly in the groove next to the bone in your shin, right? So what you want to do, if you're just sitting down there watching TV and you're getting shin splints or you're getting ankle pain or your kneecap's not tracking well and the physio said it's patellofemoral pain or anything like that, what you can do, you can get your heel in here and you can just literally slide your heel down the front of your shin like that. It's a cool little self-release. You're going to look a little bit weird at work all the time now that you sit down on the chair and you're gonna slide it. You got that? Yep. Now you can do that there yourself. Try that there for me. Can you get in far enough doing that? Try sit up and do it. Yeah, sit up and do it, and you can use your own foot to do it there. And what you can do at the same time, stretch it out. Can you get in there? Mm-hmm. Maybe roll it a bit that way. Yeah, roll it that way and dig it in. There we go. Just like that. You okay?
Yeah, it's good.
And Pap loves this because he loves self-harm. You okay?
Yeah, it's good.
Cool, man. You're doing a good job. You can actually use your own heel. It's lovely using your own body to release different muscles. And as he stretches that as he goes out, it's a lovely self-release. Like I said, shin splints, ankle pain, kneecap tracking problems, all kinds of things. Really, really cool way of doing it. Okay, so the last thing that we're going to do, jump on your back, man. You go face up. The last thing that we'll do, we're going to talk about a peroneal muscle stretch, which is also kind of like a sciatic nerve glide. These things are good for, I mean, anything in the body basically, but a lot of sciatica, you know, hip pain, calf tears, ankle pain, knee problems, anything like that, okay? So The main thing when you're stretching, you don't want to overstretch your body, and so you don't push into a pain, you push to like a strain. So you get a stretchy feeling, but you don't get sharp shooting pain or pins and needles or stabbing pain or anything going, you know, feeling faint or dizzy or anything like that. Now, whenever I stretch a hamstring style stretch, I always bend this one off to unlock the pelvis so he doesn't kind of twist his pelvis out too much. Now, what we want to do, we want to take a leg up like that. You want to grab on the stretching strap either hand. Now I've got a funky cool stretching strap, but you can use a towel or a belt or anything you really want. You can even use your hands, which I could show you afterwards. Now, just to start off with, if you bend the knee just a little bit, take it towards your chest. Now, all I want you to do is turn the foot in like that. And what we're trying to do, you imagine you've got an elastic rope between here and the side of your knee. You're just trying to make that as long as possible. And that's a lovely little stretch, right? Now, if you keep a bend in the knee, you get a bit of a hammy stretch on that, and it really pulls that fascia there, and that connects straight into that peroneal muscle. So you get a lovely, lovely stretch there, right? You can move it, you can do it dynamically, you know, sort of like 3-second holds, 3-second holds, loosening it off, and that's a nice dynamic stretching way to do it. Or you can just do the static way that Pap's doing right now. To bring on a nerve style stretch, you back off so it doesn't overstretch it, and you go a straight leg raise, which will bring on a whole stretch. He'll get a big ache, a bit of an ache in the back of your knee down through your calf. Generally, that's where you get it, and that's a nerve style stretch. Cool? Feels okay? And then another progression is just taking it down, and this is your Iyengar yoga style stretch, where you lift up the heel and you try and touch the heel on the roof. Now with stretching, I think you should probably, I mean, there's no set science behind this. You can stretch for, I think personally, 15-20 second holds, and then relax off a little bit, and then another 15-20 second hold, and then relax, and I'll do 4 or 5 of them in a row. And, you know, some people do stretch for a long period of time. They stretch for, you know, 2-3 minutes at a time and really push through. I think when you're working on the fascia, it's nice to kind of push the nervous system and the fascia into an end-of-range position, then back off and release it, and it allows the nerves and the muscles to kind of relax, and then push further into it without hurting yourself. Okay? Yep. Cool? You're pretty good?
Yeah, perfect.
All right, legend. Thanks, man. Okay, thanks for watching. Cheers. Thanks for watching our clip today. I hope you really enjoyed it. We're going to be doing plenty of these throughout the year, so make sure you stay tuned to our Facebook page, and you can get there via our website, physiosportsclinic.com.au. We'll see you soon. Cheers.